Welcome. Welcome to tonight's James Clinic Monday Night Forum. Welcome and thanks for spending your Monday night with us. Tonight is going to be a hot topic. I think a lot of you are probably interested in red light therapy. As we look at our clinic and how we make recommendations, really, if you think about your standard doctor's office, it's very one-dimensional, right? You go in, you pay a copay, they give you a prescription. It's very simple, straightforward. Two-dimensional is you go somewhere and they maybe give you some supplements, right? I feel like our clinic is in 3D. We're three-dimensional. Life is three-dimensional. Your care should be three-dimensional. So we are going to give you recommendations around sleep, around EMFs is coming up, red light therapy, what you should eat, how you should sleep, what water you should drink, all of these things, how should you move? So it's very three-dimensional. And so tonight we contribute to that three-dimensional perspective that we're dealing with. So without further ado, thank you everyone for joining us. I see some people, we've got everyone from Indiana, Michigan, St. Louis, of course. I see some people from Iowa. We've got South Dakota represented, Iowa, Arkansas. You guys are all over the place. Let's see, what else? Florida, Texas, Mexico. Let's see. California in the house. All right. So we are coming to you live from across the United States where things are pretty icy and pretty fiery at the same time. So we will get started. Lots of room for questions at the end. So please feel free to share. We're going to get right into it. Is red light therapy just a scam, or is there really something to it? And should you be incorporating this into your wellness routine? That is the question we shoot to answer tonight. So here we go. We're going to talk about what is red light therapy and what is infrared. So we're actually going to cover both of those. Does it really work? And if so, how does it work? Like, what does it do? Am I just getting a suntan, or does it do something actually deeper? And I think you'll be pleasantly surprised about what it actually does. The most tactical question is going to be device selection. So if I'm going to go out and purchase a red light device, what qualifications am I looking for? Do I splurge on the expensive stuff? Is the cheaper stuff going to be adequate to get what I need and everything in between? So I will simplify that for you as best I can. How long should I do it and how often? Practically, when I take a device home, if I decide to invest in one, when am I gonna turn on the button? And then I'm gonna give you some resources. So if you're interested in this, you can dive into it further, and then we'll get to all of your questions. So here we go. So if our body is going to heal, it requires energy. So this little bad boy here, you guys should know, is the mitochondria. So we are looking for that. So when you have chronic illness, usually it's a cellular energy crisis, right? It's a problem. The root of the root is the mitochondria. So a lot of things we're doing are targeting the mitochondria to get them working better. Again, most of that one-dimensional care is just a prescription that does something that blocks something in your body. So you have high blood pressure, let's give you something to block it and take it the other direction. We're not ever really getting at the root cause. So when we're talking about red light therapies, we're actually looking at getting into the cells and helping the cells heal from the root of the root cause. So, what is red light therapy? If we think about the electromagnetic spectrum, there is a spectrum, and all we can see is in this color range. So, when we're talking about light, we're talking about those wider 700, or the smaller 700 nanometers to 860 nanometers. So, we're in the red light, infrared. You can see those two are next to each other. Down at this end, the UV light and the blue light move slower, and then it moves progressively faster as we get here. Or, yeah, backwards. But you can see the wave size here. This is a biological signal that goes into our cells. The UV light is outside of this spectrum, so we're not really talking about that tonight. We're talking about red light and infrared. You can see the different wavelengths here. So when you're looking at devices, you want to keep these in mind. Does it have just red light? Or is it near infrared as well? So you want to know what spectrums it includes as you're going to vet those devices out. So when we look at what does a red light actually do to our cells, it actually hits the mitochondria. And I don't know how well you can see this, but see these this is actually one of those little twisty things in the mitochondria, one of the ruffles in there. And you can see there's 5 different things. So little transmembrane receptors, if you will. I think of these as water turbines. So each one of these has to push an electron down the chain to get the water turbines to roll. And at the end, that pops out an energy, an ATP. So that's how that works. So when we actually use red light or near infrared, it's going to hit cytochrome C here, and it's actually going to kind of hijack that process and make ATP faster. So it's actually going to activate our transcription factors, it's going to hit our nucleus, it's going to change our protein metabolism, it's going to change the environment inside the cells. So it's going to help the cells clean up a little bit at that cellular level. So here's another example of that. So here's ATP production in normal mitochondria. And then when we put some red light on it, we get a little extra oxygen in there. We're making more ATPs. So I want you to think of this. I'm always a visual person and I like to keep things really, really simple. So I want you to think about mitochondria as your car and the rev of your car. Okay. So if I put my red light or my car in the garage and I rev the engine, what's going to happen? I'm going to rev the engine. The engine's going to go fast, but what's going to happen in the garage? The garage is going to fill up with carbon monoxide, right? It's going to fill up with fumes and things that we need to clear out. So this isn't a one-step process. When we stimulate the mitochondria, which is our car, we then have to detoxify. We have to get all that stuff out of there. So this is a 3-step process we're going to talk about and what most people miss at the end. So again, here's your visible light, here's your infrared. Infrared is always going to penetrate further into the tissues. So near infrared is going to be more skin, subcutaneous tissues, and far infrared is going to get deeper into the actual cells, the joints for deep detoxification. So here's your 2 wavelengths of light. And over here, you can see a little bit better. Again, this is that electron transport chain. So these are those water turbines that water has to flow through each one in order to kick out an ATP at the end. So sunlight, infrared sauna hits that cytochrome C to kind of hijack and expedite that process and just make it easier for those water turbines to flow. Now, when we talk about red light medically, you guys know when we put a fancy name on it, medicine can charge more for it, right? We don't do that, but the system does. So photobiomodulation or PBM is actually the medical term that you're looking for when we apply this in a medical environment. Some things that it can do: lower blood glucose, because again, we're improving that cellular metabolism, right? So we're increasing that glucose uptake in the cells. Child autism severity scores, hair regrowth. We're going to see a lot of these applications specifically as we go. Injury prevention, injury recovery. Dental, there's dental applications. We won't get into that tonight. Wound healing is a big one. And cognitive function, to me, is a huge area of interest. So again, that cytochrome C is going to get hit by the light. It's going to help expedite those water turbines to turn over ATP, which means more energy for you, and you are a happy person. So what is infrared? Infrared, again, is slightly higher up the spectrum. That is invisible light. So you can't see it, but you can feel it as heat. I don't know if you guys have seen it. I actually have an infrared sauna just to the right of me in my house. I have a sun-lightened sauna that we used in my first clinic. But there's 3 major types. And again, basically near, just think of near is near the surface of your skin, and far is deeper in and goes deeper. So we're using those, and what this cabin is designed to do is it sets different ratios of the near versus far to create therapeutic programs. So for example, there's a cardiovascular one that's probably more near and mid. There's a detoxification protocol that's probably more mid and far. So it has different ratios of the different wavelengths in there. This you'll feel as heat. So when you're getting to that far infrared, it's going to stimulate a lot of sweating, a lot of heat in the body. And keep in mind, we know that if patients have coronary disease, they have cardiac issues, that spending 20 to 30 minutes in a sauna 4 times a week reduces their cardiac mortality by about 40%. So anyone who has a heart condition should be doing this on the regular. They can do infrared, they can do dry heat, they can do steam sauna, whatever they like, but that relaxation, that vasodilation has a big impact on their long-term outcomes. So like I said, that near infrared, the deep tissue, actually they have it the different way. Near infrared is deeper, and then far infrared is more superficial. How does infrared promote detoxification? It's going to improve blood flow. So when you heat the tissues, it's actually going to increase blood flow. It's going to increase lymphatic flow too. And this is actually what most people miss. So again, put your car in the garage, rev the engine. Well, maybe now we're going to open the garage door to try to vent that out, but you'd be better off to move the mitochondria outside and rev the engine outside where you've got good lymphatic flow. So we need that airflow around it. We need that lymphatic flow to then move the detoxified tissues and products out of the way, bringing fresh tissues back in. So detox related benefits, it can clear heavy metals, environmental toxins. So most of us here have some understanding that our world is a pretty toxic place in the air, with cooking, with food additives, with water. It's very hard to basically create an environment that we had 50 years ago. So we're all exposed to more toxins, and they're all very cumulative. So the more that we can help disseminate those, the better. It also raises glutathione levels, which is our body's master antioxidant. So it helps with all of those things. So when you're looking at infrared, more is not always better. So if you were one of those people who's like, hey, if 5 minutes is good, I'm going to do 5 hours, you probably want to not do that. So when you use infrared, short bursts are better because if you come in for, 15, 20 minutes, it's going to cause an increase in output. But if you do that longer, it's actually going to have a downstream effect that's negative. Again, short bursts stimulate the process, let the body then roll at that higher level, as opposed to continually stimulating it where it's going to burn out and eventually drop down. It improves oxygen utilization. So again, oxygen plus food is what the mitochondria uses to make ATP. ATP are our Duracell batteries. That's where we get energy from. And the IR is going to be very synergistic with red light. So when you do the two together, you're going to rev the engine of the mitochondria. Now you're going to help with detoxification. So you're going to get things moving around that, layer that in with a lymphatic plan, and you are in good shape to keep your body as healthy as possible. So we talked about the cytochrome C, that water turbine moving a little bit faster, increasing ATP, reducing oxidative stress. So when the body has uncontrolled inflammation, it creates oxygen free radicals. Those are out there creating damage all over the body. So we need to be able to absorb those and take care of them. Improved cellular signaling, we saw how downstream this is going to improve nuclear function. And again, when you're looking at, somebody who's dealing with a cancering process or brain fog, chronic infections, repair activation of those repair genes. Remember when we talked about the MDI, the mitoregen, when we're doing that, if the mitochondria are tired, they're not able to repair itself. Just like if you're tired, you're not going to go in and repair your home and clean up. So when we increase the energy, now the cells can run those DNA repair programs and really help clean up the cells, get rid of the waste, run the repair programs that our body inherently knows to do. So here's another picture of what this looks like. So the red light is really very superficial and it stays on top. You've got the near infrared goes mid, and the far infrared penetrates a little bit deeper. So what is the best way to get it? So there's multiple ways. It seems like everybody's selling a red light product these days, and I have a few that I want to show you as I've been looking into it. So you can think of it as targeted therapy versus whole body treatment. And those are going to be two different applications. So what you see here, this is a Huga. If you're in this Iowa office, they actually have this down there. It's about the size of an iPad, and it's about 1 inch thick. So this is kind of an entry-level panel. You could sit this on your desk. You could sit it in front of your feet. This is going to get only a small area of the body at one time. But you can see there's red panels. Those are the red dots. And then the clear dots are the infrared. So you can do one or the other or both together at the same time. I actually have kind of the next model up here. Let's see. So this is the Huga, the more commercial, the Pro line. So same idea. This one has a timer on the side. It's just a little bit bigger than that one is, a little bit sturdier with a stand. So this is the entry level on the professional side. It's got a little handle on the top. The guy on the screen, I think this one's about 140 bucks. The one sitting next to me is around the $300, $400 price range, just to kind of start giving you price points to associate with these. So these again are going to be regional treatments. So again, if I sat this on my desk, I sit here, it's going to treat the skin that it's exposed to. You can actually use it to treat your eyes. There's some eye applications coming. There's kind of some debate. People used to use goggles to protect from the infrared. Now there's a thought that the infrared actually can be therapeutic. The next one's the one I'm super interested in. So you can see a hat. So this is going to be great for people who have hair loss. The hat actually stimulates the mitochondria in the scalp and helps with hair growth, especially the androgenic patterns. This is the intranasal. Now, why would we use this? This is fascinating. And again, this was kind of a new concept as I was researching for you tonight. So the intranasal is actually going to do two things. First of all, it helped to restore the sense of smell to people who had olfactory loss after COVID. So that's an interesting application. But the reason they're doing it is to complement the helmet. So the helmet is going to sit on the head. We're looking at that for hair, but also for cognitive. It gets through the brain, into the brain to help with mood, addiction, cognitive, ADHD, autism disorders. It has a positive impact in all of those areas. Where this comes in is the helmet is going to be more for prefrontal and superficial. It's not going to get deep into the brainstem. So this, by shining light through the nose, actually hits that sphenoid plate behind that and hits more of the brainstem for movement disorders, things like Parkinson's. So you could combine those together for a pretty comprehensive exposure to the brain. And if any of you are interested, this is what I do for fun. So these are some of the papers that looked at and did reviews of about several hundred different devices and looked at the outcomes for each disease process. So if you want those papers, we can drop those in the chat toward the end here. The helmet, again, is going to sit on the head. Depending on the brand, you're looking at the density of the red light, the intensity of the red light. This is something we can use for cognitive issues, mood disorders, anxiety, depression, ADHD, again, autism spectrum, brain fog, those kind of things. Wide application. The problem is it's not an instant relief kind of thing. It's a gradual thing, so it's a program commitment, not just a one and done. So how well do they actually work? So in all of these, and again, I just pulled out really simply the review from the article. Again, improved mood, addiction, it reduced cravings in patients. For autism spectrum disorder patients, it improved emotional control, better executive functions, and improved sleep quality. So if you're one of those people who struggles with your sleep, there's multiple ways you could get red light that might help with that. For patients who struggle with memory issues, improved performance and function. Stroke, it didn't necessarily perform as well, but I'm thinking what we're going to do is layer the mito regen with the red light therapy and see if we can amplify that outcome and change the trajectory. Again, in Parkinsonian type issues, there were improved movements. This is with the helmet. And then in TBI, traumatic brain injury, improvement in all measures, basically cognitive, verbal, memory, concentration, and just overall clinical improvement. This is attributed to myelin repair pathways and increasing that neurosynapses, so the firing of the brain is a little bit more effective. So again, when you're looking at that's a study that showed that. Now, what if we took that and did hyperbaric and layered in the brain gauge? Now we're really cooking with gas, hitting that from all angles. So lots of promise in what that can do for central nervous system repair. This is a really cool, and this is a Kinnean device. This is your targeted musculoskeletal. So you can see you could apply it around a joint, on a tendon, on the back, anywhere that there's a localized injury. This will reduce localized inflammation. Again, layering this with something like a peptide, an anti-inflammatory, and maybe hyperbarics, you're really going to accelerate the results you're going to get. This next one is a little bit creepy. It reminds me of a horror movie, but also my vanity makes me really want to get one. So these are the red light masks, and what you see here are two different price points. So the Huga, the thing I like about the Huga line is kind of an introductory line. It's a lower price point. I think this guy's around a couple $100s, so it's not quite as fancy, doesn't have all the functionality. This little handheld guy, I've seen these a lot at different shows. I don't know, I don't want to sit and hand hold something on my face for multiple times a week. This is a little higher grade on the mask. You can see it's a little bit more durable. The remote is a little bit more extensive. I think this guy lives in the $500 to $600 range. So again, you are going to sometimes pay more money for better quality, but not always. So you need to know some of the brands that have high brand awareness, who have a lot of influencers who post for them. You know, they're at a higher price point and they aren't the same quality. So I will help you avoid those mistakes. So for whole body and systemic, you can go a couple of ways. There's panels that you can install in your home. You can sit in front of them, or there's actually red light beds that you can get to lay down in, kind of like the old tanning beds from the 80s. So if you guys don't know my background, my mom actually during the 80s was a tanning bed salesperson. So I'm quite familiar with those. This is a little bit different approach, but the same, the bed closes over the top. So just depending on what you're looking for. And then one of our most popular things is our Theralumen watches. So this is a wearable red light. Applications for this, it has 4 15 or 30-minute treatments in it. The reps take it skiing, so it really helps them with altitude. It helps reduce hemagglutination or red blood cells sticking together. So it increases the oxygen carrying capacity of the blood. It's going to help with the workouts. So reduces inflammation, some pain relief as well. So lots of different options of how to get these. So how much and how often, just like everything else, it kind of depends on what are our goals and how severely are you injured. I'm always a fan of start low and go slow. So see how your body's going to respond to it. Again, I'm not going to jump in and do a red light for an hour. Start with 5 or 10 minutes and then increase. Really 20 to 30 minutes is all you're going to need, and just how many times a week. That's really the top end of that. So you can do anything from 5 to 30 minutes. Again, we need to know what we're trying to treat. What are we monitoring to declare success of the treatment? If somebody has an acute injury or surgery, you're probably looking at doing that every day to try to get ahead of things. This would include surgery, surgical wounds, injuries, broken legs, lacerations, anything you want to heal faster. We're going to be doing that mostly every day. For chronic pain kind of things, still frequently. And then that performance and recovery, or just kind of to maintain and optimize, you're looking at the 1 to 3 times a week. So again, it all depends on what are our targets, what are our goals, how are we layering that with everything else. Now, the part people forget the most. That is the lymphatics. So if you are not familiar with the lymphatics, if you've never paid your lymphatics respect, tonight is the night to do that. So the lymphatic system, we all know about the arteries deliver blood out, the veins bring it back. The lymphatics are the secret silent warriors of our body. You probably mostly have heard about this if you know anyone who's had a breast surgery. When we operate on the axle and we take out a bunch of lymph nodes underneath the arm, the lymphatics in the arm can tend to get backed up and they can have swelling in their arms. So these are little whispery tracts. They're passive, so they're dependent upon muscles contracting in order to shoot fluid up the tracts and back to the body. So for example, in the arm, moving your arm around is going to track that fluid back up here. It's going to go through the axilla, and then everything is going to dump in through the thoracic inlet back into systemic circulation right here at the thoracic duct. So from an osteopathic perspective, the first rib has a layer of fascia right here. So if you are not aligned right here and it's kinked, that thoracic duct that comes in and goes through that can be obstructed. So the first thing we want to do is we want to treat T1 or the first rib and make sure that is optimized. Then we want to start things like dry brushing, rebounding, things like that to improve. So it has no pump. It is dependent on the function of the body. This is where ICU patients get in trouble because they're just laying there not moving. So muscle movement is important. Breathing. So the movement of the diaphragm up and down is actually going to be kind of a passive pump for the lymphatics. And then vibration. So one of the things I've just invested in myself is a vibration plate. So you can stand on it and it shakes and it kind of sends that fluid up. A rebounder does some of the same things. Sure, we'll go back and do that. So when lymph stagnates, so when you have an area that's sore, that's tender, that's ticklish, or asymmetrical, basically that's going to be an area that needs lymphatic return and attention. So there's all kinds of everything. There can be everything from a lymphatic massage very gently to very aggressive deep tissue lymphatics, using those local vibratory devices to get things opened up, the fascial scrapers. Gua sha for the face is a good example if you're familiar with that. That is all based on lymphatics and getting stagnant fluid out of the face and moving. So there's been pretty high-end med spas and things that do this, but you don't need anything that fancy. Again, if that happens, you're going to notice swelling, you're going to notice inflammation, poor detoxification, your immune system is not going to be as effective, and things are just going to heal slower, right? Because you're like working through molasses. You're in that garage with the door down and things aren't airing out. So we've got to keep it all flushed through and moving so that it can be processed properly. So here's another look at that. So here's the cells with the nucleus in here. The mitochondria are revving their engines. So we've got increased production. We've got the infrared to clear that out and detox it. Now in that green space, we need all that lymphatic to get pulled away and keep the blood delivering fresh stuff in, lymphatics moving stuff out. So if you think about it, we cover every step in this process. We've got the revasca to get the endothelium so we can deliver oxygen into the tissues. We're looking at the mitochondria through the mitoregen. Now we've got the red light and the infrared, and then get the lymphatics going. You've got the whole system covered. So things that we use to move lymph, I like drinking hot lemon water in the mornings. That's really good. Frankincense or boswellia is pretty good for this as well. We have a homeopathic called Lymphomyosoft. Lymphomyosot is excellent. Lymph activator is another one through Cellcore. Again, just movement and exercise, like not being stagnant, is going to be really important here. I'm a big fan of chiropractic or manipulation or massage to get those tissues going. If you've ever seen anyone who does the lymphatic massage for aesthetics, dramatic change. I guarantee you all the models are doing this before the big shows. Again, least of our concerns here tonight, but important to keep in mind. So vibration plates, there's again an entire spectrum of introductory to very fancy high-end vibration plates that you can do. They're very different and have different outcomes based on the quality. Basically, this helps rapidly contract your muscles. So by creating an unstable platform, your body is constantly responding to that. Small muscle contractions, we're moving the lymphatic flow, we're getting more circulation. So has anyone here done a vibration plate or anything like that? A rebounder, do you have that as part of your practice? Yes, I'm seeing some yeses. Do you get itchy afterwards? Like, does your skin get itchy afterwards? Like, that is just things moving around, right? That's getting everything unlocked and freed up and flowing again. Yep, itchy. You notice, yep, for sure. Okay, it's not just me. You used to, but now you're doing it daily. Okay, very good. So again, rebounding, dry brushing is another one. You start at the outset and you move down lymphatic pathways and you move it up towards centrally. Same thing, you start with your feet. You have major lymph nodes at the pelvis, at the diaphragm, under the arms, and then again at T1 or that first rib, important. Okay. Breath work is going to be important here. Massage and then staying hydrated. Lots of water to keep things moving around. So tying it all together, your red light is going to signal your mitochondria to increase your ATP production. Then you want your infrared to come in and that deep heat for cellular detoxification to clean things up, right? Clean out the cytoplasm. Now that we've got the energy to run those programs, let's detoxify. Now we're going to add a lymphatic drainage to that. This is going to be really good for complete cellular health. All right. So every cell needs mitochondria. So this is a complete cellular reboot. So we need oxygen, we need calories, but this is just kind of an introductory. This is tipping our toes into the water that we are energy. We are energetic beings. We have charges. We have a voltage. We have an energy and a frequency that go through us. And so we need that exposure to the sun and the different rays of light to stay alive. Very good. Now, I already saw a question, so I'm going to go back and Kurt, I'm going to answer your question, but I don't think it's quite what you think it is. So when we look at what wavelengths we're going to use, it is not disease specific, it is tissue and treatment specific. So if we're trying to stimulate the mitochondria, we want the red light, the 630 to 660. If it's deeper for detoxification, we want that near infrared to far infrared, which is going to be the 800 to 1000. So those are the wavelengths you're looking for in those instances. There are some devices that will do some blue light. That's going to be more antibacterial. I've seen some green light. There are some of these devices that have a little bit of orange spectrum in them as well. So all of those different spectrums do different things. All right. I am going to, oh, yep. Last thing I wanted to do is give you guys a couple of resources. So IMAhealth.org, Dr. Ryan Cole did a nice review of photobiomodulators or light therapy. He and Christina Carmen are both senior fellows at IMA. So you might want to go there. They have a little guide that they've created. It says basically what we've talked about tonight. And then one of the great resources, if you really want to do the deep dive, if you like to know all the facts, Light Therapy Insiders, this is a great YouTube channel. It's an online resource. They have buying guides and they tell you what to look for. Basically, when you look at these devices, you want to consider a number of things. You want to consider the density of the red light panels. You want to look at how much energy they use. You want to make sure they don't have any dirty EMFs coming off of them and some things like that. So, and then you want to consider basically how can you stack and add devices? How do they work together? Do you have to have multiple remote controls, or can you get a system where you can just keep adding and growing all of that? Okay, is there any that do it all? So I would say yes. Let me see if you can see my infrared sauna. Let me try to turn this without spilling anything here. So if you can see over there, that is my infrared sauna. So in that will do infrared of all three wavelengths. And then I don't know if you can tell. Yep. See the green light, purple, the light. So it actually has light therapy built in, and you can stop it and do any one of those, or you can do, you can just let it roll and get the benefits of all the different colors of light. You can get all-inclusive units. There's a red light cabin. It's quite an investment, but putting a vibration plate in the red light cabin, we've heard has helped with cellulite appearance. So there's some aesthetic uses as well. Cool. So mostly people were asking, like, do the wraps work? Amazon has quite a collection. So this kind of dovetails into the difference between blue light and red light, and sleep optimization is where I think it was going next. So our world is contaminated with nasty, dirty blue light. So if you've ever looked at the videos where they slow down the pixels, you can see that the blue light flickers. So it's constantly flickering on and off, kind of like a strobe light. And that's what your eye sees. So if you're exhausted ever and you work in that kind of environment, you're probably blue light toxic. You need to get outside. You need to get sunshine a lot more often. If any of you know Jack Cruz, he it's an interesting, this is like a tweet that I printed out, and it's 15 pages of how everything's connected to the melatonin and the pineal gland and the rays of light. So he makes some interesting connections about basically sun exposure reduces all-cause mortality across the board. So using things like sunblock and being inside all the time is about the worst, unhealthiest thing we can do. So again, it ties into that. It ties into cleaning up your light source at night. You want more red or amber light as you're going to bed because that will stimulate melatonin production versus the blue light is what you want in the morning that suppresses melatonin. Collagen building. Yes, Roxanne, I believe you guys have red light beds, getting rid of those fine lines and wrinkles. Hey, that's up there. Just depends on your priority list. So, all good things. I guess the answer to that is you don't have to necessarily spend a fortune to get a good product. You can start with something small and work your way up and see how you use it. So I wouldn't be surprised if you start seeing these in our office as we start incorporating them into our different treatment protocols and recommendations. So red light screen protectors for your phone. Yep, there's settings on your computers that, obviously it's dark early, so you want to knock down that blue light exposure as early in the day as possible, shift away from the blue light into the red light arena. So I see two hands up. Do you guys have questions? Mark, go ahead. You are muted, so if you want to talk, Mark, you're on the stage.
Can you hear me now?
We've got you.
We're just wondering, how would the hot tub fit in on any of that, as far as, like the saunas or helping with circulation?
Yeah, that's a good question. I haven't seen any data on that, but I would think if you're in a hot tub for 20 minutes 4 times a week and you have that vasodilatory and relaxation periods, that it would have a similar benefit, but I haven't seen anything specific to that. So that's a good question.
Thank you.
Yeah, thank you. Kurt, go ahead.
Hi.
Hi.
You mentioned red light frequencies at 630 to 660 and infrared at 800 to 1,000. Can
Yes.
you zero in on cancer for a minute? And
Yep.
which frequencies do you think apply to that? And maybe I missed it, but I'm wondering how each of these would apply to cancer.
Yeah. So I would take it out of disease process again and just think of it as what are we trying to do in the cells. So I don't think there's a different one for cancer versus acne versus, the other. So what we're looking for is mitochondrial stimulation and detoxification. So let me share and go back to this slide. So if we're looking for mitochondrial stimulation, you want those red lights. If you want the deeper detoxification, you want more the 800 to 1,000. That's going to be your infrared waves. So that's going to be your physiologic benefit, not just necessarily a disease state direction.
Can both of those lights be accomplished in one unit?
Yep, that's actually one of the quality parameters. A great question. So I'll go back to this one. Let's see. I don't know if I will try to turn this on, and I don't know if you can see it.
Yep, we
Uh,
can.
yeah. So the autofocus on my thing doesn't work so great. So I can do, so that's just infrared. So you can see the light is off, but it's still producing heat and sound. So I can hear it. And then you can do just red light without the infrared, or you can do both. So it's got 3 different settings on it. I don't know how well you can see that, but the best panels are going to have both.
And you mentioned working on the mitochondria. Do they each do that?
So your red light is more your mitochondria, your infrared is more your detoxification. So it's going to hit a little different place in the body of the cells as opposed to where the mitochondria absorb the energy. And it's going to work more on increasing glutathione and processing things out of the cells. So slightly different.
Okay. Thank you.
Yeah, great questions. Thank you. Roxanne, my husband had wonderful results with Dr. James' cancer protocols, and red light was significant help for healing after colorectal cancer surgery. He was golfing and drain free in 3 weeks. His insides doing surgery as well. I think I know what that means. Yeah, he did great. He did excellent. Thank you very much. Except for consistency, how is this different than sun gazing? So the sun actually emits infrared light, and it does so most at dawn and dusk. So if you're out the very early at sunrise, you want to get that natural light without sunglasses on your eyes. It's really great for your health. And you can do the same thing. You probably want to skip, especially in the summer, that midday where you've got more UVA, UVB, and then the infrared is going to be higher again when it's more at sunset. This is just, again, narrowing the spectrum of light in there.
Really, I'm interested in red light therapy.
There we go. Does red light therapy wake up the mitochondria and then require sugar similar to your new therapy? So they don't actually mention that as much in anything I came across in red light. So I would think that's pretty specific to what we're doing with the mito regen. That's a specific pathway that it's hitting. It's a little bit different. So I would think of this more as kind of like an adjuvant to methylene blue, where methylene blue, let me grab a diagram here and pull that up for you. Yeah, here's a good diagram of that, and I'll get to all those questions. So when you look at this water turbine again here at the bottom, so your red light's going to hit cytochrome C and the number 4 protein. Your methylene blue is going to hit this last one too. So it kind of hijacks this entire electron transport chain and kicks out an ATP. So I would think of red light more as methylene blue, and the mito regen is going to actually hit the mitochondria as a whole and getting that fuel source of glucose in from the outside. So I think different pathways, but that's a really good question. Would the nasal help pituitary disorders? I would sure give it a try. You don't have a lot to lose. The nasal devices, I think, are around $150 to $200. So I would do that specifically for each patient. That's not going to be one we'll share in the office, but I would certainly give it a try. So this is a great question. Are there concerns with EMF exposure with any of the brands? So if you go to that last resource I gave you, he actually tests those for EMF exposure, and most of these are really good on that. Yes, it is a concern, but you go to a product reviewed, and the ones that we have are all pretty good. Great question. Would red light help hypothyroid issues or if you have thyroid nodules? I think it would be worth a try. They do have, with the mask, there's actually a décolleté piece that goes over the neck, so I would approach it with something like that. They also have wraps that you can get, so you could do a neck wrap. Sometimes I have patients do the wraps around their joints, so that would be good. Are there a particular order to do these for maximum benefit? That's a good question as well. So you can do them all at once. So you could actually do your red light therapy and your vibration plate at the same time. Again, a lot of these panels have the IR and the red light together, so you're getting both at once. And then if you layer in some kind of a lymphatic return, whether it's drinking hot water or a vibration plate or lymphatic massage, you can do one or the other. But again, I would want to be mindful to do all of them in a comprehensive plan. So, good question. Do I have recommendations of an instrument to purchase that could measure the different lamps from red light to IR to determine authenticity of the lamps? No, not the instrument, but again, if you go to that resource, let me show you. So the Light Therapy Insider. So Alex Ferguson, again, his entire channel is him testing these devices. So he goes through how he tests them, how he assigns points to them. So one of the things he does is he measures the spectra of light and how much you're getting. He measures how far out it goes. So he measures the EMF, he measures the density, he measures how much electricity does it take, all of those things. I would use his buying guides. I've kind of pre-selected those for you and any of our offerings. I'm more interested in how to use them clinically, and I'll let an expert like him vet the actual products out. There is a product that I thought was pretty high level based on influencer recommendations that I probably will not be buying based on his reviews. So find somebody like that, but Light Therapy Insiders would be a great place for you to go to get that kind of vetting that you're looking for. What was the reference that reviews products shared in the chat? Yeah. Yep. Light Therapy Insiders. Again, it's a YouTube channel. It's online. You can sign up for a newsletter and they'll send that out pretty regularly. Kurt, did you have another question?
I did. Yes. Thanks. On the lymphatic, on the plate, you do that vibration plate for a while. And what's the after effect on that? I mean, does it do something to your system? Are you supposed to pass more bad stuff out in your waste, or can you?
Yep. So a lot of people notice that actually reduce swelling. So sometimes, when you eat Chinese food, your fingers kind of swell up. Some people have that all the time. So you'll notice when you do something like a vibration plate, that will get better, especially if you're doing it with water. You may notice things flushing out in the urine, yet not usually the stool, but we also think of the stool because as things get returned to the lymphatics and processed through the liver, they're going to go out in the stool. So again, when I meet somebody, if they're really, really sick, my baselines for them are like walk a little bit, drink a lot of water, make sure you're pooping every day, and sleep. Like really the basic things, and maybe some vegetables in their diet just to get things moving a little bit because stagnation is what kills us. So you want to keep it moving.
Okay, I had one more question, and
Yeah.
my age has made me forget it, so I'll raise my hand again if I can remember.
Oh, okay. All right. Very good. I'll leave you unmuted in case you think of it. And let's see. I'm knee replacement, so I've noticed if they hurt, I'm on the vibration plate too long, so 5 minutes. Yeah, there's actually different ways you can do the vibration plate. So you can straighten your legs and then it kind of shakes your whole body. You can bend your knees and then your lower, it really gives you a lower body workout. You can do balance training where you're on one leg and then the other. So it just depends on the vibration plate you have. Katie on our team also has, there's a band you can put on there. And so it vibrates, like if you're working on an arm specifically, it'll vibrate the arm. So you can do targeted therapy. So there's a lot of things you can do with that. You can incorporate it into workouts because, again, it helps those fine agility fibers deal with that. So, like if you put your feet on the vibration plate and then did a plank and have the vibration plate going, it's going to help your core stability. Excuse me. Okay. Did you talk about PEMF mats? I have not. So they all kind of are birds of a different feather. I haven't talked about PEMF mats, and I haven't gotten into that yet. So I'm all about it. This is kind of histotripsy and music therapy and PEMF and red light therapy. It all kind of gets into the same thing. Hemolumin in our office is light therapy. So lots of ways we can go on that. Steve has the wristband. Is there a way to change the battery? There is not, but bring that into the office and talk to us. Will red light facial device activate my melasma? It actually can. So that's why the lymphatics is so important, and you start low and go slow. So you don't want to jump in one for 2 hours. You want to try it for 5 minutes in maybe a hidden area and see if it's going to activate it. Some people I've heard melasma is actually more of a liver problem and a detox problem. And that kind of gets into the Jack Cruz stuff. So lots of sunlight for that. All right, Melissa, go ahead.
Thank you. I'm just wondering what you would recommend for any patients that have the elevated high B cell count. Because when I took a look, it said that if you got the elevated B cells, that it could actually make you sicker, just like if you're in the sun, almost like if you were developing like Sjogren's or lupus. And I looked it up because I have a lamp and I got sick. So I'm wondering what your recommendations are for that first off. That's the first question. I have two technically.
Okay. Yeah, I'm not sure. I don't know if that's a detoxification issue we need to focus on a little bit more before doing the red light therapy, or starting with a different wavelength would maybe be better. So I'd have to look into that specific question.
Okay. And then my other question is the vibration plates. I have one and I love it and I use it, but I am thinking about withholding the use of the vibration plate because I have a really high angiocardiolipin, like 150. I don't want to have a clot accident. Does that sound smart?
So I would totally focus that differently. So they used to tell us when I was a DO, if somebody had a blood clot, don't let them walk, don't do manipulation, don't manipulate people with cancer and do lymphatic returns. I'm now on totally the other side of it. I would not worry as much about that as I would doing Ravasca to get the endothelium lined up and the testing on that side. So I would handle that totally differently. And yes, I would absolutely do the vibration plate, and I would not let that stop me.
Okay, good to know. That's what I wanted to know because I know they've not been entirely truthful with us. I appreciate it.
In some areas, right? In some areas. Okay, thanks, Melissa. John, I'm coming to you. So, John, what's your question?
Yeah, that Hugo version that you showed there tonight, you had mentioned that you could direct that to different locations. I see
Yes.
they are available on Amazon, and I'm interested in maybe purchasing one.
Yeah.
So, as you know, I'm dealing with prostate cancer. Would I direct that to my groin area? Is that what I would do?
You actually could. Yeah. You could do it there. You could do it on the abdomen. So
Okay.
there's some with perineal, like directed light. I don't, that would be a little bit logistically challenging, but you certainly
Yeah.
could. I would probably do more like lower abdomen, upper thighs,
Okay.
things like that. You could also get like a wrap device and consider that. So yeah, you could get
Okay.
close. Yeah.
And how long would you say start out, 5 or 10 minutes?
I would
And
start
then
out 5 or 10 minutes and work your way to 20, no more than 30 minutes at a time.
and how many times a week?
So I'd probably do 3 to 5 times a week for an ongoing issue like you're talking about.
Yeah. Okay, that's great. Thank you.
Yeah, you are so welcome. All right. Kurt, did you think of your question?
I did. I'm
Okay.
going to drop back to your MDI treatment for a minute. You've had a chance to be running those machines for a while now.
Mhm.
Are you noticing any of your patients losing weight after, after going through various treatment, after a number of the treatments?
Yeah, I would say weight loss is not anything either good or bad. So we're not, the main issue we're seeing is like increased energy, neuropathies are going away, better sleep. Some people are telling us better vision. Some people's guts are healing up. So we're seeing lots of healing. I'm seeing lots of improvement in lab values. I'm starting to get labs back on people who've been doing it now. Improved kidney function. The main downside we have is to the glucose that they're eating during the day. So either getting nauseated in the office or having like massive diarrhea from all the sugar load. That's the main problem we have with it. So we're lowering our threshold to put in a second IV and do the D50.
Are you prescribing a meal that somebody should eat beforehand, a specialized meal, or how's that working?
I wouldn't say a specialized meal. I would say carb load, but not just sugar. So I wouldn't go eat pancakes and syrup. If you're going to eat pancakes and syrup, I would do some sausage or bacon or eggs or something with it, like something a little bit solid. Otherwise, people are getting sick. So we need a little bit of that sweet, salty balance. And then, like I said, we have the lemonade and the D50 in the office. We've got some snacks. It's too much for some people who aren't used to eating that way. So low threshold to put in that second IV.
Okay, thank you.
Yeah, you're welcome. All right, we are at the top of the hour, so I think we've answered all the questions. Oh, there's an oral device for pain in the teeth. Okay, great. Excellent. Good to know. So this will help you vet out if it's a solid resource or not. You give you some brands to look for. Go to that Light Therapy Insiders if you want a more comprehensive, but I'm going to be working on bringing some good stuff into the office so you don't have to worry about vetting it. We will vet for you. So excited to see what's coming next. Next week, we are going to be talking about the MCG, the multifunction cardiogram. I believe that's next week. Oh, Renee has a question that was missed. Where did you put it, Renee? Oh, if you use a small red light panel, is it able to help overall or is it just for targeted? So again, small is going to be targeted, right? It's just going to be the area that's exposed. So if you want full body mitochondrial regen, you're looking at a bed or a large panel, swimsuits or naked at home, something like that, as opposed to a small panel like this isn't really going to be your systemic, like overall mitochondrial reboot that you're looking for. But this might be good for, I had a patient with really bad eczema and skin issues, and she was able to use a device like this on her legs, and it cleared it up 90% in a week or two. Yep, great question. It's going to be more of a targeted approach. So thank you for that. Roger just got a far infrared sauna. Do I need a red light device also? You may want one. With all the things you have going on, it might be a good thing for you to incorporate as well. Again, that little iPad guy it starts at around $140, $150, and you can go all the way up to several $1,000s depending on what you're looking for. So you definitely can find something, to fit your budget and your goals with a high quality device. So thanks everyone for being here. Until next time, tune in for the MCG, the multifunction cardiogram. We'll do a deep dive into what is it, what does it mean, what does it tell you, who should have it, and keep your questions coming. So if you're not on our email list, send an email to hello@jamesclinic.com. And if you have not given us a 5-star review on Google, we really appreciate those. So please take a minute and go into Google and just give us a review. You know that they've blocked us and no one can find us. They took us off for 18 months. So we are trying to break their algorithm. So if you can go in and give us a review on Google, that would really help us. Make sure to go to our YouTube channel and subscribe so that you can see all these videos when we repost them live. Till next time, God bless and good luck.